Effectiveness of yoga therapy as a complementary treatment for major psychiatric disorders. A meta-analysis. This is by Patricia Cabral, Hilary Mayer, and Donna Ames. It's published in the Primary Care Companion for CNS Disorders and published in the National Library of Medicine, National Institute of Health. Abstract. To examine the efficacy of yoga therapy as a complementary treatment for psychiatric disorders, such as schizophrenia, depression, anxiety, and post-traumatic stress disorder. Study selection. All available randomized controlled trials of yoga for the treatment of mental illness were reviewed, and 10 studies were eligible for inclusion. As very few randomized controlled studies have examined yoga for mental illness, this meta-analysis includes studies with participants who were diagnosed with mental illness, as well as studies with participants who were not diagnosed with mental illness, but reported symptoms of mental illness. Trials were excluded due to the following: insufficient information, inadequate statistical analysis, yoga was not the central component of the intervention, subjects were not diagnosed with or did not report experiencing symptoms of one of the psychiatric disorders of interest, the study was not reported in English, or the study did not include a control group. Data extraction. Data were extracted on participant diagnosis, inclusion criteria, treatment and control groups, duration of intervention and results. Name, number, age, and sex ratio of participants were also obtained when available. Conclusions. As current psychopharmacologic interventions for severe mental illnesses are associated with increased risk of weight gain, as well as other metabolic side effects that increase patients' risk for cardiovascular disease, yoga may be an effective, far less toxic adjunct treatment option for severe mental illness. Psychopharmacology and psychotherapy are the primary treatment modalities utilized in Western psychiatry, yet the effectiveness of these therapies is limited. The well-accepted biopsychosocial approach for the treatment of mental illness has been expanded of late to include a spiritual component as well. Yoga can play a role in this comprehensive, holistic, biopsychosocial, spiritual approach to healing mental illness. In addition to limited effectiveness, psychopharmacologic interventions, particularly alone, are associated with side effects. Most notably, the antipsychotic medications used widely in the treatment of schizophrenia, bipolar illness, depression, and post-traumatic stress disorder are linked to metabolic side effects such as weight gain, diabetes, and dyslipidemias. The combination of those metabolic side effects, particularly obesity, with severe mental illness, pose a major public health problem. In searching for ways to reverse antipsychotic medication-associated weight gain, we have identified yoga as an acceptable form of exercise, as well as a plausible adjunctive therapy for the treatment of mental illness, particularly in the reduction of anxiety and depressive symptoms. Yoga as a complementary treatment. Yoga is an ancient Hindu practice that has only recently been documented by the Western world for its potential therapeutic effects. An increasing number of empirical studies have reported positive effects of mind-body therapies for the treatment of mental disorders, such as depression and anxiety. The National Institutes of Health Center for Complementary and Alternative Medicine defines mind-body interventions as a variety of techniques designed to enhance the mind's capacity to affect bodily function and symptoms. It's believed that yoga practice enhances the connection between the mind and body, and it is used as a therapeutic intervention in a variety of diseases. The mechanisms that allow for the potential therapeutic effects of yoga have been described as the modulation of the autonomic nervous system, especially a reduction in sympathetic tone, as well as activation of antagonistic neuromuscular systems and stimulation of the limbic system. Clinical points. You can be effective in treating symptoms. Yoga can be effective in reducing symptoms of depression and anxiety. Yoga has few contraindications and few side effects. Yoga may be helpful complementary treatment for psychiatric disorders. There are many different schools of yoga that consist of different components, such as physical poses, yoga poses, asanas, controlled breathing or pranayama, meditation, dhyana, energy awakening, alignment, flexibility, chanting and singing, and word repetition. The studies included in our meta-analysis employed the forms of yoga used most commonly in the West: Hatha Yoga, Iyengar Yoga, Sudarshan Yoga, Kriya Yoga, and different types of meditative yoga. Hatha Yoga, the most popular form of yoga in the West, emphasizes the asanas or physical yoga poses. Unlike most exercises, asanas are done slowly and are intended to encourage coordination between the body and the mind, to inspire relaxation and awareness, and to de-stress the mind. Iyengar Yoga, a form of Hatha Yoga created by BKS Iyengar, focuses on the structural alignment of the physical body through the development of asanas and uses props, such as belts and blocks, as aids in performing the asanas. Iyengar Yoga has been developed so that it can be applied to various ailments, diseases, and disorders. Sudarshan Kriya Yoga emphasizes slow and modulated breathing. Ujjayi, Bhastrika, and Sudarshan Kriya Yogic breathing, thought to alleviate anxiety, depression, everyday stress, post-traumatic stress, and stress-related medical illnesses. The mechanisms in Sudarshan Kriya Yoga thought to contribute to calmness include increased parasympathetic drive, calming of stress response symptoms, and the reduction of neuroendocrine release of hormones such as cortisol. Meditation, a component of yoga employed by some studies, including in our analysis, can be described as a conscious mental process that induces a set of integrated physiologic changes termed the relaxation response. Functional magnetic resonance imaging has been used to identify and characterize the brain regions that are active during meditation. Research suggests that during meditation, parts of the brain known to be involved in attention and in the control of the autonomic nervous system are activated, providing an anatomic and neurochemical basis for the effects of meditation on various physiologic activities. Meditation has been shown in one study to produce significant increases in left-sided anterior brain activity, which is associated with positive emotional states. Some studies have suggested that meditation can actually raise dopamine levels and exacerbate psychosis. However, these studies were not randomized, controlled studies, and therefore more research is needed to assess possible negative effects of meditation for individuals with mental illness. Yoga is relatively safe and well tolerated, with very few side effects when practiced correctly. Nevertheless, yoga therapy has not been established as an empirically based adjunct treatment to psychiatric disorders, and the purpose of this meta-analysis was to examine the efficacy of yoga therapy as a complementary treatment among individuals with psychiatric disorders, such as schizophrenia, depression, anxiety, and PTSD. Discussion. Results from the meta-analysis demonstrated that yoga therapy is an effective adjunct treatment for several psychiatric disorders. Example, depression, anxiety, PTSD, and schizophrenia, with a pooled mean effect size of negative 3.25. Yoga-based practices may provide relief for symptoms left untreated through common treatments such as psychopharmacology and psychotherapy. Yoga breathing is probably one of the most important components that can be useful in the treatment of anxiety and PTSD. Yoga breathing pranayama requires a person to inhale deeply through the nose into the lungs. This alone can be very calming, mindful activity that can decrease stress. There were some signs of heterogeneity and publication bias among the trials, but exclusion sensitivity analysis did not indicate that one specific trial had a major impact on the pooled effect estimate. In addition, analysis of the fail-safe N revealed that we would need to locate and include 202 null studies in order to nullify the effect found. If this number had been relatively small, then there would be cause for concern. However, this number is large, and thus we can be confident that the treatment effect, while possibly inflated by the exclusion of some studies, is nevertheless not nil. Due to the relatively novel interest in yoga-based interventions as an adjunct treatment for psychiatric disorders, few well-designed, controlled, randomized studies were found. Thus, we can be sure that a large number of null studies do not exist at this time, and confident in our finding that yoga therapy has a significant effect as a complementary treatment for psychiatric disorders. A limitation within the study was the lack of trials investigating specific disorders available for inclusion in a meta-analysis. Insistence that yoga therapy should be conducted under the supervision of a trained instructor only, a factor limiting widespread use of yoga in psychiatric disorders, could be a potential reason for this lack of trials. Of the 10 trials included, most investigated the effect of yoga on depression and/or anxiety. Only one trial was found investigating the effect of yoga on schizophrenia. Finally, although several studies were found that investigated PTSD, only 2 included a control group, and 1 was excluded due to lack of information. With such a limited number of trials, we were unable to examine the difference of yoga therapy efficacy for each of the psychiatric disorders of interest. Future meta-analysis should investigate the difference in efficacy of yoga therapy across different psychiatric disorders, the efficacy of different yoga-based practices, and the efficacy of other alternative interventions such as Tai Chi, Qigong, and dance. The findings of this meta-analysis provide support for the use of yoga as an effective adjunct treatment for psychiatric disorders. Yoga may provide an inexpensive, effective alternative to common treatments presently used in the treatment of psychiatric disorders, as the yoga intervention included in the meta-analysis consisted of postures, breathing exercises, meditation, and a varying combination of the components of yoga. It appears that synergistic yoga interventions may have differing degrees of efficacy in comparison to yoga interventions that consist of only one single yoga component. Findings in support of alternative and complementary interventions may aid in the treatment of psychiatric disorders presented in this study, and may be an aid in the treatment of additional psychiatric disorders in which current treatments are found to be inadequate or to carry severe liabilities. Yoga therapy has been understudied, and more well-designed studies are needed before definitive conclusions can be drawn about yoga's use for specific mental illnesses. Future studies should examine dose response and whether more classes per week predict a greater effect. They should also examine head-to-head comparisons of yoga directly to pharmacotherapy. Recently, the U.S. government, the National Institutes of Health, and the U.S. military have turned to complementary and alternative medicine, especially yoga, for the treatment of anxiety and particularly PTSD. The National Center for Complementary and Alternative Medicine has recognized the benefits of yoga and currently is funding 30 clinical trials of yoga for various medical conditions. Although research on yoga is still in its infancy, the results to date are promising, and large-scale, well-controlled trials should soon follow. Potential conflicts of interest, none reported. Funding support, none reported. Previous presentations presented at the 28th Annual National Institute of Mental Health Career Opportunities in Research, Education, and Training